Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them faster than a slam dunk. Today, we talk about the norovirus, the most contagious stomach bug. Challenge your mind with these questions before we start. What's the significance of norovirus being non-enveloped? Which test is required to diagnose norovirus infection? Which other calicivirus infects humans and mostly affects young children? Let's get the wheels running. Norovirus, once called the Norwalk virus, belongs to the Calliciviridae family. It's non-enveloped, making it environmentally stable and resistant to disinfectants. Its positive sense single-stranded RNA genome allows rapid replication inside host cells, unlike negative sense RNA, which requires an extra step. The icosahedral capsid protects the RNA and helps the virus attach to cells. Norovirus only needs a few particles to infect someone, and its capsid proteins can change shape to escape the immune system. It attaches to sugars on gut cells called histo-blood group antigens to infect them. The bug spreads mainly through the fecal-oral route. That means people can get it from ingesting food or water contaminated with stool from a norovirus-infected person. It passes easily between people through close contact. Other transmission methods include touching contaminated surfaces and inhaling tiny vomit droplets. Norovirus can infect everyone, regardless of age, but outbreaks are more likely where many people gather. Children in daycare and schools, passengers on cruise ships, and residents of nursing homes are especially at risk. Healthcare settings are also vulnerable because sick patients and staff can easily spread the virus through contact with stool, vomit, or contaminated surfaces. After exposure, norovirus incubates 12 to 48 hours before symptoms appear. Patients then suddenly develop vomiting, nausea, watery diarrhea, abdominal cramps, low-grade fever, and body aches. Symptoms usually last 1 to 3 days, but can be longer in people of advanced age or with poor immunity. Dehydration and abnormal levels of electrolytes like sodium and potassium can arise as complications of the illness. Individuals with weak immune systems can get long-lasting infections. Norovirus isn't associated with cancer. Diagnosis is usually based on symptoms alone, especially during outbreaks. Reverse transcription polymerase chain reaction, with stool as the specimen, is only needed to confirm the virus in outbreaks or unusual cases. There's no specific cure for norovirus, so treatment focuses on supportive care. Patients should drink ample fluids to prevent dehydration. If there are dehydration signs, such as dry mouth, very little urine, or low blood pressure, fluids are given intravenously. Antiemetics such as ondansetron can help if vomiting is severe. Prevention is key. Wash your hands with soap and water to remove the virus. If you touch food, eat, or use the bathroom, disinfect surfaces with bleach, handle food safely, and isolate anyone who is sick to stop the virus from spreading. Sapovirus is another member of the Calliciviridae family that infects humans, but it mostly affects young children, is less common than norovirus, and usually causes milder symptoms. Outbreaks happen less often, and diarrhea is more common than vomiting. Let's go back to these questions. What's the significance of norovirus being non-enveloped? Answer: it makes the virus highly stable in the environment. Which test is required to diagnose norovirus infection? Answer: none. Diagnosis is usually based on symptoms. Which other calicivirus infects humans, but mostly affects young children? Answer: Sapovirus. Flawless run? You're the GOAT. If you learned something from our clip, help us grow by hitting like, share, and subscribe. Scan the summary table in the description. Thanks for watching. Follow Med in 5 for more high-yield med nuggets.